hopefully this will be very informative and educational session for us all. I want to just give a quick update on the status of the department. On the educational front, we successfully matched all our 5 residency spots within the top 20. We had over 400 applicants this past year for the 5 positions. This effort was led by Russell, and again, I think we have an outstanding class of diverse residents coming in to join our program. Our procedure volume, our case volume remains very high, and that's a primary attractive feature to the residents coming in. Our 5-year average is almost 800, and we're close to 800 on our last year's residency performance. In addition, through the indigent care clinics, the residents have provided comprehensive eye care to over 9,000 low-income Alabamians over the past year. We are engaging in a department-wide strategic plan integrated with the hospital, and we're currently undergoing this internally and plan to have a retreat in the fall. This plan is designed to redefine our educational, research, and clinical goals with this new integrated organization combining both the department and the Callahan Eye Hospital. As part of this in the summer, we plan to engage our alumni within a variety of surveys and roundtables to get broad input into the educational mission of the department and how we move that forward to serve the needs of the clinical needs to our patients in Alabama. One of our focus areas is going to be diversifying the educational portfolio in the department. We've broken up some time in the second year already to create a research track for residents, but we want to expand those options to tailor those options to individual resident needs to give them some practice management experience, a health care and advocacy track, and some outreach international, time for outreach international. We're trying to form these up and create space within the residency program in the next year as part of the strategic planning process. Over the past year, the Callahan Eye Hospital and Callahan Eye Clinics in the department have integrated to create a merged organization. The purpose of this integration is so we can better meet the healthcare needs in a changing payer mix and prepare us for more population health initiatives. This has been a long, arduous process and has taken the work of many people on the hospital side of the department to push this forward, but I think we'll be better prepared to meet the needs of our patients, fund research, and move forward as an academic medical center. The main thing we're concerned about is a massive expansion of patient volume. If you look at glaucoma alone, there's going to be a 120% increase projected from demographics in the next 10 years. And we have 7 glaucoma specialists in the department, and we're all overloaded. We've got to devise more efficient, more distributed ways to deliver care, and the cost is just going up. So I think we look forward to an increasing expansion of the elderly population and less money to take care of those patients. So integration allows us to expand, vertically integrate, and develop a population health platform as the expected payer changes come online in the next few years. In terms of growth over the last year, with our integration, the surgical volume of the eye hospital has reached record levels at over 1,100 cases in the past year. That still keeps us about 1 out of 4 cases at UAB are done at the Callahan Eye Hospital and our eye cases. We're expanding our ORs from adding 7 more ORs in January of 2017, so that'll allow us to free up more surgical block time for private and departmental medical staff. The faculty clinics exceeded 88,000 patient visits last year, and that's up from 45,000 3 years ago. We've developed 7 new satellite locations over that period, again, to try to distribute out the primary, less complex care into the community. The IER volume has also exploded over the last year. It's nearly doubled in the last few months. That should be 5.7 thousand visits last year. On the research side, over the past year, 2015 to date, we've had 7 new federal grants, and since the last Alumni Day, we've had 4 new federal grants. Dr. Downs, who's an ocular biomechanics expert and engineer, is exploring interocular pressure and perfusion pressure fluctuations in an animal model as a risk factor for glaucoma. Paul Gamlin, a neuroscientist, within the department is studying these photosensitive ganglion cells that have photosensitive pigment and respond to light, and how they project into the brain, and if these could be used as an accessory visual pathway for visual rehabilitation. Dr. Rhodes, one of our newer members of the glaucoma service, a young clinician scientist who received a K-23 training grant in glaucoma telemedicine, which is an integral piece of our health services research platform. And finally, Dawn DiCarlo, who's director of the Low Vision Service, has developed a NIDER grant looking at reading in pediatric low vision. Lastly, two sizable Bright Focus grants were obtained by Dr. Raphael Gritz, another biomechanical engineer, looking at computational models of how the optic nerve tissues remodel in response to glaucomatous injury, and Dr. Downs again looking at the role of cerebrospinal fluid pressure and how that regulates as a potential mediator in glaucoma for damage. All in all, this brought for 2015 a total of $13 million in new revenue in new grants revenues over an extended period, and it brings our annual revenue to over $5 million dollars in research. And this is about a 100% increase in our grant funding over the last 4 years. We still face challenges in research. Federal funding continues to decline. The pay line, the percentage of grants that are actually funded, is continually going down. If you look at the age of average funded the average funded investigator, it's gone up by a decade over the last 20 years. So you're looking at clinicians getting their first funded studies in their mid to late 40s on average, and that's a significant change. So the challenges. We have challenges both on the clinical side, the educational side, and the research side, while continuing to thrive. And one of the major strategies to try to meet these challenges is development of a capital campaign. In January 2017, we're going to kick off the 2020 capital campaign for the Callahan Eye Hospital and the department. And this represents the 20th anniversary of the combination of UAB and the Callahan Eye Hospital and the creation of the Eyesight Foundation that's supported a lot of our work. The campaign goal is to raise $10 million over the next 3 years. And in the silent phase of the campaign, which began in January 2016, we've raised $2.5 million already. We hope to get to 50%, to the 50% mark before kicking the campaign off in January. Jackie Wood, her information's in your packets, is leading this campaign. She's the Executive Director of Development for the Callahan Eye Hospital and the department, and also the Senior Development Director for UAB School of Medicine. She leads a team of development officers that she's developed to push this initiative forward. With regards to the Alumni Development Fund, an important key component of that capital campaign this year, it's going to focus on the development of resident careers, funding travel, mentorship, and coursework. And I'm happy to talk with any in the audience about these initiatives at your leisure. Thank you. Before we move on, I'd like to introduce Lena Najia, who is going to talk for a few.
Thank you, Chris. My name is Lena Najia. I'm neuro-ophthalmology at Callahan Eye, and Dr. Reed graciously allowed me a couple minutes just to talk a little bit about this clinical trial that's going to be starting soon at UAB. We're quite excited about it. This is a treatment trial for non-arteritic ischemic optic neuropathy, and as you all know, there really is no treatment at this point for this disease, so hopefully this will kind of guide us to the next phase in this disease. Again, this is an international multi-center clinical trial. It is a treatment trial. It's sponsored by Cork Pharmaceutical, who of course manufactured the drug, but also by the Neuro-Ophthalmology Research Consortium. Okay. And this is a treatment trial. The treatment will be an intravitreal injection of the medicine, and about 80% of patients will receive some type of treatment. So only 20% will receive a sham procedure. The drug is a synthetic double-stranded RNA that's shown some promise in stopping apoptosis or retinal ganglion cell death, and so we're hoping that will provide some potential benefit for these patients. So again, we're looking for patients with non-arteritic ischemic optic neuropathy. These are going to be your typical 50 to 80 years of age, male or female, with acute onset NAION. The treatment has to start within 14 days of onset of symptoms, which is why we want to make this make you all aware of this trial, because time is of the essence to get these patients in. They do have to go through pre-treatment assessments, and so we want to kind of get them in as soon as possible. And again, these are just exclusion criteria. I think the big ones are, if they've had NAION in the study eye previously, which would be quite rare. Any clinical evidence of temporal arteritis would exclude them, or any medications that could potentially cause optic nerve toxicity. You should have a little brochure in your packets with the referral information, just some key features of this. There is a contact information for our study coordinator, Lindsay Gregg. You can contact her directly, and she can coordinate to get these patients into our clinic so we can evaluate them and hopefully enroll them in the study. And both Dr. Vafiatis and myself will be involved in this clinical trial. I think I have